Welcome to OET Answers.
Your preparation time is over. Now, you can start your speaking role play. Don't worry if I stop you when the time is up.
Hello there. I'm Florence Nightingale, one of the nurses here. I understand you're experiencing some discomfort today. Could you tell me what brings you to the emergency department?
Hi. Yes, I've developed these painful blisters and sores on my face and hands over the past couple of days. They started off small, but they've rapidly gotten worse, and I'm worried it might be Impetigo.
I see. That must be quite concerning for you. Let's get more information so we can understand what's going on. Can you tell me exactly when you first noticed the sores and how they've progressed since then?
Sure. It started about 2 days ago. At first, there were just a few small red spots, but by yesterday afternoon they'd turned into these fluid-filled blisters. Now, some of them have burst, leaving these crusty sores. It's spreading quickly, and it's painful.
That sounds very uncomfortable. I'm sorry you're going through this. Apart from the pain, are you feeling any itchiness around the affected areas?
Yes, they do itch a lot, especially at night. It's really hard not to scratch them.
That's understandable. Itching can make things worse, though, because scratching might spread the infection or make the sores worse. I'll make sure we discuss some ways to help with that.
Okay, I'll try not to scratch them, but it's tough.
Of course, I understand. I'll also make a note to talk to the doctor about getting something for the itching and pain. Now, have you noticed any other symptoms, like a fever, chills, or generally feeling unwell?
I did have a slight fever last night, but it didn't last long. Other than that, I feel okay. Just really worried about these blisters.
Thank you for mentioning the fever. That can sometimes be a sign of an infection spreading, so it's good that you brought it up. Let me ask you, have you had any recent cuts or insect bites in the areas where the blisters are forming?
Not that I can think of. I mean, my skin was normal before this started. No cuts or bites that I noticed.
That's helpful to know. And have you been in close contact with anyone recently who has similar symptoms, like blisters or sores?
No, not that I'm aware of. I live alone, and I haven't really been around many people lately.
All right, thanks for sharing all that information. Based on what you've told me so far, I understand why you're concerned about impetigo. It's possible that this could be a bacterial skin infection, but there are other conditions that can cause similar symptoms, so we'll need to run some tests to figure out exactly what's going on.
What kind of tests will you do? I'm really anxious to find out what this is.
I can imagine you're eager to know, but I want to reassure you that we're going to take good care of you. The first step will be to take a skin swab from the affected areas to see if there's any bacteria present. The doctor may also request some blood tests, depending on what they find during the examination. These tests will help us determine the cause of the blisters and sores so we can treat you appropriately.
How long will it take to get the results?
The swab results usually take a day or two, but the doctor will be able to give you more information once they've examined you. In the meantime, the most important thing is to avoid touching or scratching the affected areas to prevent spreading the infection to other parts of your body or to others.
Okay, I'll try. But do you think it's impetigo? I've been reading about it online, and the symptoms seem to match.
It's good that you've been looking for information, but I can't provide a diagnosis myself since that's the doctor's role. My job here in triage is to assess how serious your symptoms are and make sure you get the appropriate care. After we complete the initial assessment and tests, the doctor will be able to give you more details about what's causing the blisters.
All right, I understand. I'm just really worried about how fast it's spreading.
I completely understand your concern, and you're right to seek help quickly when things are progressing so rapidly. You're in the right place, and we're going to make sure you get the attention you need. The doctor will see you soon, and they'll discuss treatment options with you. Does that sound okay to you?
Yes, that sounds fine. I just want to get to the bottom of this.
Absolutely, we'll do everything we can to get you answers as soon as possible. For now, I'll ask you to take a seat in the waiting area, and we'll call your name shortly to begin the tests. The doctor will also see you soon after that to discuss the next steps.
Okay, I'll wait. Thanks for your help.
You're very welcome.
That is the end of your speaking role play. All the best.
Thank you.
Thank you for watching. Please like and subscribe for more videos like this. Kindly comment your suggestions and help us to do better.